one and all. Sandeep basically like to take this opportunity of
Sandeep, I'm unable to hear you. Yogi, is there a technical glitch or is it just for me?
No, ma'am. I think Sandeep sir had a small issue.
Okay. Yeah, anyway, he has gotten us started. So maybe I'll continue from here, Yogi. So good afternoon, everyone, and thanks so much for making time to join this session. At the moment, I'll just give you a single glimpse of what are we doing and why. The why is more important because we are now observing the World Health Day 2022. And the theme for this year chosen by the World Health Organization is Our Planet, Our Health. Now, why this theme and what are we doing today? So what we have to keep in mind is this theme is based on its impact to public health because we are the public. There is an impact on our health and therefore this theme has been chosen by the WHO and is being observed by 194 countries in the world, which are all member states of WHO. Why is this being done? Climate crisis is also a health crisis. I think the reason it is in quotes is, of course, because it's from WHO, but also because it's important. We think climate change is something else, health crisis is something else, but no, they are both together. The other aspect we have to bear in mind is there is a need for one health approach. What do we mean by one health approach? It means that we understand clearly that our health, the human health, is completely dependent on the planet health, which is our environment, animal health, because it impacts our food chain, and plant health, because that also impacts our food chain. Unless we understand these interconnecting links, the way we see human health has always been very myopic. So today is a good day to become more expanded in our horizon and understand without the planet's health, without animal health, without plant health, there is no way we will be healthy. More important, during the pandemic, it has exposed the inequalities within a country and among countries, whether it is the vaccine inequity or when we all struggled with not having access to PPE, which we should not forget. We have just shown how unequal we are as a society within a country and between countries. And most important thing for today is what is our individual role and what is our communal role in addressing One Health approach. So from here, I would like to hand it over to Ms. Chandana, who's representing the Indian Pharmaceutical Association and the Student Federation part of the Indian Pharmaceutical Association there. So Chandana, over to you, please. Thank you.
Thank you, ma'am.
Sorry, Chandana, give me 1 second. I'll stop sharing. Yeah, there, I've clicked the button.
I'm still a start.
Sorry, Chandana, what's it? Please do.
Ma'am, are we good to go?
Yeah, please proceed, Chandana. Go ahead. You're good to go.
Yes, ma'am. Thank you, ma'am. A very good afternoon to everyone. Hope you all are doing safe and are in great health. On behalf of Indian Pharmaceutical Association Student Forum, I would now like to warmly welcome each and every participant and thank you for being a part of this webinar. First of all, I wish you all a happy World Health Day. Health refers to physical, social, and mental well-being. And we all are aware of a proverb saying, health is wealth. Yes, good health indeed is a treasure for humans. To stay healthy is not an option, but a necessity to lead a happy life. Therefore, we need to preserve our planet as well as our health, which is the main motto of our today's webinar. Next slide. Okay. Now I'm going to introduce myself. This is Chandana Rayella, currently pursuing as a PharmD intern at St. Peter's Institute of Pharmaceutical Sciences, Warangal, Telangana. And I'm one of the subcommittee member of Indian Pharmaceutical Association Student Forum Liations 2020, which is an official student wing of IPA. And I'm proud to, I'm here to represent IPA Community Pharmacy Division, which aims to improve the public health through community pharmacy services. Next slide. I'm sure most of the participants are well versed with IPASF, but for the benefit of those of others, I would now like to talk about the highlights of IPA and IPACPD. IPA, Indian Pharmaceutical Association. It is one of the oldest pharmaceutical professional association in India that has been established way back in 1939 in Banaras Hindu University. Currently, IPA operates through 20 different state branches and more than 46 local branches. And you could visit our official website at www.ipapharma.org. As you can see, the picture here illustrates the Indian Pharmaceutical Association. And we are the Community Pharmacy Division representing, and the others are Indian Industrial Pharmacy Division, Hospital Pharmacy Division, IPA Education, and IPA Regulatory Affairs. Next slide. Yes, actually, I can tell you that the IPA Community Pharmacy Division is one of the youngest division, but it is one of the most active and the most vibrant of IPA division. And the projects and activities that are held under IPACPD are development and advancement of community pharmacy, improving pharmacy services and pharmaceutical care pertaining to the medication use, that is improving patient-related outcomes and the patient quality of life, thereby ensuring the patient welfare. As you can see, we are having several collaborations with variety of sectors such as FIP, SEA Farm Forum, Government of India, and Pharmacy Council of India. And we also have collaborations with multinational pharmaceutical companies like Eli Lilly, Abbott, GSK, iMedSource, and Pfizer, etc. Next slide. IPA have created a division in 1996 to make the pharmacists aware of their role in the community. And IPA-CPD aims to improve the public health through community pharmacy services and also aims to enhance the role of pharmacists and raise its professional standards of pharmacy practice through its activities. Next slide. As you can see, here are the IPA collaboration with FIP PharmaBridge training and community pharmacists over abroad, namely pharmacist Sagar in Boots Pharmacy, Scotland, and pharmacist Ratnadeep in an Australian pharmacy. Next slide. And as you can see here, it is CARM is an initiative that has been initiated by IPA, and in 2014 that have been called as a campaign for awareness on responsible use of medicines. That is responsible for use of medicines and also creating the awareness among the people. And it is developed for comprehensible posters and booklets regarding the use of medicines for the general public in 6 different regional languages of India. And you can get access of these at our official website, www.ipapharma.org. Next slide. As you can see, here are a few past patient information leaflets and medication information leaflets that have been issued under CARM. Next slide. So here comes a layman handbook of responsible use of medicines that has been released under Indian Pharmaceutical Association and Pharmacy Council of India. Next slide. So we are all having a lot of activities in pipeline of IPA-CPD, including the campaigns like antimicrobial resistance and lifestyle disease campaigns. And we are also planning for pharmacy practice research and training modules for pharmacists, mentoring pharmacy students, and conducting a lot more webinars. Next. And I would now like to invite you to join hands with IPASF and IPA-CPD, where there are no sky limits for your learnings in the professional development of pharmacy. You can stay connected with us for more updates at social media, Facebook, LinkedIn at the rate IPA Community Pharmacy Division. Next slide. Now, I would like to brief about Indian Pharmaceutical Association Student Forum, which is an official student wing of IPA that has been officially established in 2008, which consists of motivated young pharmacists and pharmaceutical graduates within the IPA for many years. The main objectives of IPA-SF are to facilitate the connections and networking so that the new ideas can be shared and to open the doors for information and new possibilities. And IPA-SF is widespread and currently it is in about 15 states with 5,000 members in it. Next slide. And here comes our beautiful team of IPASF Student Forum and Mr. Yogendra Kanchapu being the president of IPASF. And we also have different 3 subcommittees with the further divisions, namely Project Subcommittee, Public Relations Subcommittee, and Liaison Subcommittee. And I'm indeed very delighted to be part of this harmonized team. Next slide. And the activities in the pipeline of IPASF, which we are planning to conduct in the near future, are mentorship program, metaverse hackathon, networking events, exciting competitions, internships, and webinars. Thank you for providing me this opportunity. Over to you, ma'am.
Thanks a lot, Chandana. That was a really nice overview to tell us what the IPA is doing, but more important, what we are all very proud of is what the Student Federation is doing, because at the end of the day, it is all about nurturing the next generation leaders, and we are extremely delighted and privileged to have people like you leading it, and people like Yogi who are taking everything forward. So thanks a lot, Chandana. Rashmi, if there are still technical glitches and we need to sort it, please let me know. Otherwise, Jaye Pillai can go ahead and give us a very short introduction about how she's representing Rhodes University in South Africa and how her work impacts public health, because she plays a crucial role at the university from the infrastructure division and all of that. So Jaye, just 1 second, just making sure if Rashmi can take it forward. Otherwise, it's you, Jaye.
Should I say good evening? Thank you, Dr. Sunitha, Srinivas. It's an absolute privilege and an honor to be in your company. It's so wonderful to connect with you and with the students and the bodies from India. My name is Jaye Pillai. We've shortened it to Jaye. It's easier for the South Africans to call me Jaye as opposed to Jaye Lakshmi. I'm a director of residential operations at Rhodes University. And my portfolio at Rhodes includes students' wellness in terms of the provision of services that ensures their health and safety, their food, their nutritional well-being, and their comfort. So it's housekeeping, food services, cleaning, conferencing. It's quite a big portfolio. But besides that, I also sit on the board for Higher Health South Africa. And Higher Health South Africa is a body that's linked to the Department of Higher Education and Training, and they work with various health activities on our campuses to ensure health and well-being of our students across our 26 public universities. I also sit on the board of APTI, which is an abbreviation for Association for Colleges, Universities, Housing Officials, and that's a South African chapter. And this is a body of practice. And through the conferences, seminars, and webinars through COI, we are able to also ensure health and well-being of students across campus. So you might think that what is students' well-being as opposed to public health? I believe that our universities are a microcosm of the greater world that we live in. And we need to focus on the well-being of students on our campuses. Because public health is an important factor in our everyday lives, because we have to constantly strive to close that inequality gap between people and encourage equal opportunities across all that we do. And I do think our universities represent that factor. I've also worked with Dr.Sunitha Srinivas with the Peer Educator Program, and that is to ensure well-being of staff and our students on campus. And there were various programs looked at HIV and smoking and how bad smoking was for one's health, and that's to name a few. With the recent pandemic, obviously it has affected us globally, and our campuses were exactly that, a microcosm of what has happened globally. So I've sat on the COVID task team, and we had to, as WHO has changed and adapted to all the different COVID regulations, the CDC adapted to the COVID regulations, so did our countries, and we had to then take it down to our universities. And we all know that health is a human right, and we had to then make sure that we had all our ducks in a row to ensure a safe and well campus. By setting up self-quarantine facilities, self-isolation facilities, to ensure that our students are taken care of. Recently, when the vaccination programs were rolled out, we set up a vaccination site on Rhodes campus to ensure that all our staff and students were vaccinated. We have a vaccination mandate, so you have to be vaccinated to be on our campuses. We have, proud to say that we have 97% of our staff who have been vaccinated and 96% of our students who have been vaccinated. Though those that haven't been vaccinated can apply for an exemption. I've also worked very closely with our pharmacy department, and on a yearly basis, I lecture to the second year pharmacy students, but from a patient perspective, I have an autoimmune disease called myasthenia gravis, and it's quite a rare disease. And on an annual basis, I'm called through to talk about my patient experience, and that is a public health matter. And through that, we're able to engender very caring relationships with the students and their patients. Because my experience having MG really through the medical professions in Grahamstown, because it's quite a little town that's stuck quite far away from the big cities, and for them to try and work with someone with MG, the medication, the care, the research behind that. So I talk to the students about how they can contribute to a patient's well-being by being compassionate. So I think public health has so many different levels. It's not just providing a service, it's that connection between patient and pharmacist, patient and doctors, understanding where your patients are coming from and what is their social context, what is their background, and how you can create programs and reach out to them to ensure that we have a safe and healthy world. It's just, sorry, Dr. Sunitha Srinivas, I'm trying to see how I can create that linkages with what I do and public health. But what I'd like to say that student well-being on our campuses is a public health matter. And if you look at how universities have created programs and healthcare facilities, psychological support to ensure well-being of students, like I said, it's a microcosm of the world that we live in. Through my association with COI, the Association for Colleges, Universities, Housing Officials, we would like to look at coming through to India and to do some benchmarking with India to see how things are done on that side and how we can improve the programs that we have for students at our universities through higher health and through the organization that I sit with. But I think on that note, Dr. Sunitha, thank you very much. It's such a pleasure to be with you.
Thank you, Jayalakshmi Pillai. I mean, I've never called you that way, but I think today is a good day to start that. That was a wonderful way to summarize the multiple tasks that you put in at Rhodes University, but also to kind of create links between India and South Africa moving forward. I think that was that came through very strongly. So thank you so much for that, and really sincerely appreciate the time and energy of put in, making sure you join us and wishing us well. Thanks so much. So thanks, Ajay. So Rashmi, if you're ready to go with technology supporting you, over to you, Rashmi. So we really heartily welcome you, and thank you for, I know you have an entire day's program happening today. So despite all of that, thank you for taking the 15 minutes that you're going to invest into our group of students here. Over to you, Rashmi. Thank you.
Pleasure being here. Thank you so much for having me here in the webinar. Good morning, everyone. Good afternoon, actually. I will be talking about community health when it comes to residents' welfare associations. Let me just get my screen going. Yeah, so I'm the secretary of my community's residents association. Just a moment, I don't think the screen is moving. Yes. So we're a small community of about 92 plots in Mysore with 20 homes built. So there are 72 empty sites. And there are 3 or 4 homes being built every year. It's a very green site. It's a green area. We love being there, and it's got varieties of fauna. We have mongooses. We have varieties of reptiles, not so, welcomed by many of us, but we have varieties of snakes. We have bats. We have owls, kites, bee-eaters, kingfishers. The fauna there is just amazing. We have 2 CA sites, both of which are identified as parks, and one of these has a pond in them. So what I will be telling you today is how, as a residents association, we have tried to look at the issues in the residents association, and keeping the nature in mind, we have tried to make it easier for the residents in terms of their health. So the issues that we typically had was that with 72 open sites, we had a lot of parthenium growing there, parthenium and lantana. So a lot of residents were complaining of allergies, respiratory problems, dermatological problems, skin itching, etc. Secondly, as I told you, we had a lake. We have a lake in our close to our premises in the park, and the last monsoon was very heavy. So we had a lot of flooding all over in the colony, and the lake also flooded over right until about February. So we had constant water being lost into the stormwater drain system. The flooding also caused a lot of dirty water ingress into the sumps in many homes, and the low-lying sites became bogs, which were vector breeding sites. The pond water quality is a little abysmal, if I may say so. So therefore, it was a site for vector breeding, lots of mosquitoes, and looking at dengue season, malaria season, etc., it was a problem for us. And it was also impacting groundwater quality. Open wells in our locality were getting dirty water in the wells. Looking at these problems, what we did was first undertake a round of cleaning. So wherever the parthenium had grown, we employed JCBs or weed cutters and cleaned up all the empty sites. We have not removed anything from the root yet because we do want local flora to start growing again. We just want to get rid of the parthenium and lantana, which are the problems, but we do not want to remove all other growth which harbors natural fauna. And we've done all this before the rains so that when the rains come, natural flora can sprout and grow. We also live in an area where you have a lot of cattle around. So we allow the cattle to come in and graze within our colony. We have ensured that there is no burning of waste. Invariably, what we see is during summers, people just set fire to dry vegetation so that it is cleaned out. But we did not want to allow burning of waste. So we have spent a little more money, but we have cleaned it out using the weed cutter and the JCB, as I said. We are hopeful that during the monsoon soon, we will have local flora growing back again and allowing our cattle also some food. As for the flooding, we are looking at rejuvenation of our pond. We are looking at bringing a lot of stakeholders together. So there are experts in the area of pond rejuvenation. There are agencies which actually do the work of rejuvenating ponds. There are a lot of government bodies from whom we have to get okays from. And there are multiple community organizations who would like to be part of these things. There are lots of people who want to do good things in communities and for the environment. As a Residents Welfare Association, what we are trying to do is bring them all together. So the Rotary Club of Panchsheel, Mysore has evinced interest, saying that they would be able to bring in NSS students to provide Shramdan for rejuvenating of the lake. We have spoken with MUDA and other government bodies to see if we can get approvals to rejuvenate the lake. We are in conversation with experts in Mysore and Bangalore who have been working in this space to ask them what all needs to be done and getting quotations from implementation agencies. We are also on the lookout for funders. So we are talking with people like CII and other corporates to see if CSR funding will be available to rejuvenate this pond. Now, what we are looking at is to actually clean out all the undergrowth, allow better percolation of water into the groundwater. Any excess water, this time we just had a lot of water flowing out into the stormwater drain. Instead of having it flow into a stormwater drain and get dirty, what we were looking at is to shift it into bore wells. Pretty much every house in Mysore, whether they need it or not, digs a bore well. So groundwater is being extracted, not enough is being recharged, and that's a problem across the country. So what we're looking at doing is any excess water from our pond being filtered through a natural filtration system and pushed back into deep water bore wells so that it recharges groundwater. But all this will take time, and from what we've heard, it may take something like 3 to 5 years before we get all the stakeholders and the money and everything going. So in the meanwhile, what we're doing is cleaning out all the drains and connecting everything to main stormwater drains so that we do not have bogs everywhere and we do not have vector breeding grounds. Now, the pond water quality is a problem for us. So we have tied up with the Department of Fisheries, and they have given us about 150 guppies, which we have released into our pond. We are hoping that they will grow and they will help in a little bit of remediation of the pond. We have tried introducing the guppies into the open water wells, and they have worked very well. This is a much larger area, so we're hopeful it's going to work now. This has been recently done. Let's see how it goes. But what we are also doing is on the far side of this pond, if you can see where my mouse is, in this area, residents of the colony have grown close to about 200 trees in this space. They spent a couple of years watering the saplings and ensuring that they all took root. Now, most of these trees have taken root. So I would think in another 5 to 10 years, we should have a lot of trees in this area. You will not see a blank area here. You will see it hopefully like a mini forest. That's our hope. So this is what we have been doing, but we do have a wish list too. What we are looking at is composting. Composting is pretty high on our wish list. Currently, a lot of us are just giving away our wet waste to the cows that come in. We have a lot of cows visiting our colony, but as more and more homes come in, the cows will stop coming and we will have waste issues. I think waste is a problem in every resident association, be it an apartment, be it a gated community, be it a non-gated community. Waste is thrown everywhere. Segregation of wastes and composting of wet wastes is something which is high on our list, and we hope to get working on that. Leaf litter is a problem, huge problem, which is typically around January, February. That's when most of our trees shed their leaves. And instead of burning leaves, because that is what most people do, is they just set fire to these dry leaves, which causes a lot of air pollution. We are looking at leaf composting and giving the compost out to colony members, because every member in our residents association is an avid gardener. So we've got lots of varieties of trees and flowers and green plants growing everywhere. So everybody can do with compost. We are hoping that our colony becomes a site for bird watching and nature education. If we've got a lake, we've got trees all around us, the birds are only going to come. And we do have quite a few birds. I've seen blue jays, I've seen Indian rollers. We have a robin trying to build a nest in our house. We do have the birds like the cuckoos and the miners, which are invasive species. We also have pigeons, but we have a variety of bird fauna. So we're hoping that we will become a site for nature education. We are looking at better water management. Water impacts human health tremendously, and it is coming into focus into the bigger cities. But in a place like Mysore, people let the Kaveri flow out of their taps without a second thought. And I do think that we need to do a lot of work to create awareness on better water management. And that's something that is there in our wish list of community actions. If anybody has any questions, I would be happy to take them if there is time for the same.
Absolutely, Rashmi. If there are one or two questions, especially because with your presentation, it is about what individual actions as well as what resident associations can do, which applies to all of us, irrespective of where we are, whether we are in an apartment or whether we live in a gated community. So this being such an important topic for today's discussion, if there are any questions, if you could please indicate to Yogi, you will be able to unmute and ask. Until the questions come up, Chirag, would you want to volunteer by asking a question to Rashmi, please?
Thank you for the opportunity. Yes, it is in fact, it is in World Health Day right now. We are just going through it where humans have lost the care of Mother Nature. So this all things initiative that we just saw, it is such a overwhelming thing for an individual like me. People are focusing upon the nature and trying to heal the nature. Yeah, I would just like to put thanks a lot for your contributions, and yeah, as a human being as well, and as an individual, as a responsible individual, I would be cautious, much more sensible towards these things. Thank you, Rashmi, for your initiative.
Thank you, Chirag. It's a completely community initiative. The few homes that are there, everybody is participating in all these actions. Absolutely. And when you have a community that works together, then it is much easier to do a lot of these things.
Absolutely, the community has to come in, and whatever you guys have been doing right now, the healing process for the mother nature, Mother Earth. So in contrary, the corporates, the other people, like, the industrialists, so-called industrialists, they are just mining and reaping out of reaping the things out of nature, and this is something we are doing as a part of saving our future generations. So yeah, really appreciated on your approach. Would like to be a part of it, and obviously I look forward to being part of such ventures in my days to come.
Thank you. That's nice to hear.
Great.
Excellent, Chirag. Next generation leaders like you have a key role to play. And just to take the conversation forward with one other comment possibly coming through. So Chirag, you did a very nice thing. Even though there is not a question per se for Rashmi, what you did was you let us know how did it impact you and what do you wish to do having heard this presentation. I think that's also a nice way to take a conversation forward, not necessarily with a question, but rather with a comment. So if there's anyone else who would like to comment from the Acharya group, please go ahead. Or from IPA-SF, Chandana.
If there are no comments or questions, what I would end by saying is that if any of you do come to Mysore, come visit our community, see what we are doing, meet up with us, and perhaps as students, if there are some projects that you want to take up in our community, environmental project, in my community health projects, we'd be more than happy to be a part of it.
Right. That's a good suggestion, Rashmi. We can actively pursue that with some of the institutions in Mysore. And now that COVID is slightly giving us some breathing space, these things can start happening. Thank you, Rashmi. Much appreciated. And thank you for inspiring all of us. And all
so
strength to the wonderful work that you keep doing. Thank you.
Thank you.
Excellent. Dr. Krishna, could we have your presentation if everything is fine with technology? Just checking with you, Krishna.
Yes. Can you allow me to share the screen?
Yes. Yogi is here. He has the magic wand. Rashmi, you'll have to stop sharing, I guess.
Yes, I'm doing that.
Thank you. Yes, Krishna, we can see the screen now.
Okay. Thank you, ma'am. Thank you for giving me this opportunity to present with this webinar. And about my introduction, being a medical graduate with public health masters and working for the health programs in subnational level, especially in the South India. Medical epidemiologist working on the public health programs, mostly on vaccination programs, currently working with Japego. So with that, my introduction, I would like to proceed with my presentation. So this World Health Day objective is to keep humans and planet healthy and foster a movement to create societies to focus on well-being. So in this situation, the entire globe is having a lot of issues like war, and one side the war crisis, another side is the vaccine crisis, vaccine shortage. Previously we had the another way, we had a pandemic situation, and we have a polluted air and polluted water, and we have polluted food also. So in this situation, the World Health Organization correctly chose the thematic intervention on our planet and our health. So this theme intervention is our planet and our health, which is focused on our clean air and clean water and clean food. So I would like to give the brief introduction about what is the disease burden of these polluted air and polluted water and unsafe food and all. So this picture, the poster is being developed by World Health Organization, which clearly says that there are lung diseases happening. There are families have issues with pollution, and we have to focus on non-conventional energy like a windmill or a solar electricity kind of thing, and we have to use more on bicycles rather than using petrol or a diesel vehicles, and we need to save the trees, and we need to save prevent the heart diseases, and a lot of things they have described in this picture itself. And we will proceed to the next slide for what is the global burden of disease due to the polluted air and unsafe drinking water and unsafe food habits. So really we missed a lot of things in the past several decades, maybe 20-30 years. We have using a lot of technology advances. At the same time, we have lost the air quality and safe drinking water and safe food habits. So what will be the global burden of the disease currently, and how the entire globe is affected? So the first one is the billions of people are still having a breathing problem due to the unhealthy air, which is recent WHO data says that billions of people still breathe unhealthy air, especially in the developing and less developed countries. Around 6,000 cities now under the monitoring of air quality index as per the WHO data. So these two indicates that most of the cities are polluted in the world, and as well as the most of the people in the cities, they are inhaling the unhealthy air. And the data says that air pollution kills 13 people every minute. Every minute 13 people are killed by due to the unsafe the polluted air, which is causing lung cancer, heart disease, and strokes. So this is a huge crisis in the world, and this has to be handled by the governments and the regulatory authorities as soon as possible, and immediate action is needed. So for this, stop burning fossil fuels like oil, coal, or natural gases. And what is the polluted air is causing a problem is 9 out of 10 people, they breathe the polluted air all over the world. So again, stop burning fossils and the oil and coal and natural gases, which will prevent the breathing exposure to the polluted air. And clean water, what is the cost of clean water is happening in the world. Around 3.6 billion people, a lack of safe toilets globally, which is causing untreated human waste degrades the ecosystem and human health, which is causing a human health. So this has to be taken care of the governments and the international agencies. By 3.6 billion people don't have a proper toilet facility or safe toilets, which is causing contaminating the drinking water system or water contamination by the fecal matter. And the clean water in our planet, which is causing 2 billion people, they have a lack of safe drinking water globally, which can cause waterborne diseases and the other the other untreated water, which can cause the waste agents, chemicals, and entering into the lakes and rivers and groundwater, which is a huge pollution, which is causing the unsafe drinking water. And this is the number around 8,29,000 people die from the diarrheal diseases because of the polluted water and poor sanitation. So both the toilet facility and the unsafe drinking water, which is causing the diarrheal diseases, which is a huge burden for the globe to prevent the waterborne diseases, especially diarrheal diseases due to polluted water or contamination of the water. And what is the safe food in our planet? How to save the food in planet? So unsafe food is linked to the deaths of estimated 2 billion people annually, including the many of them are children. Why? Because many of the current food habits are changed from fresh food to preserved food, which is more longer shelf life, which can have preservatives and chemicals, which can cause us the human body to get reactions to the chemicals. So the food containing, apart from that, the food containing harmful bacteria and virus and parasites and chemical substances, which is used for the preservatives, and more than 200 diseases ranging from the diarrhea to cancer. So we need to have a safe food habit from farm to a plate. We have to make sure that the food is safe. And to make the food safe in our planet, the food safety is the shared responsibility, not only by the producer as well as from the farm or even before the farm, how they are cultivating the food, groceries or vegetables or cereals, all these things. So it is important to work all the food production chain from the farmers and manufacturers and processors and vendors and consumers. So here the WHO says that 5 key areas to save the food for practical guidance for the preparing food. So the key one is keep clean everywhere, and key two is separate raw and cooked food whenever, even if it is a home or a hotel or the community kitchen, wherever. Keep the food separate. For raw food and cooked food, we should keep it separately. And key three is cook food thoroughly. The partial cooking or a half cooking makes always contamination. So cook the food thoroughly. And key four is keep food at the safe temperatures, whichever prescribed by the material as per the food index. So these foods some of the foods has to be stored in a warm condition, some of the foods has to be stored in a refrigerator 2 to 8 degree temperature, and some of the milk or curd they should keep it in the sub-zero temperature as per the recommended guidelines. So keep the food at safe temperature, which is recommended by the manufacturer. And key five is use safe water and raw materials. So use the water in a safe conditions, and as well as the raw materials, which has to be used in a safe way. So safe food in our planet, the nutrition is groceries and the producers avoid highly processed food. So usually the groceries are the more commonly purchased by the individuals and families, which is nearby local producers, which can help them to grow well, and as well as the avoid highly processed food like highly chemical stabilization and the preservatives and processed food we can avoid, so that our body can easily digest the food properly. And the consumption pattern of the food, usually when we are buying the most of the food in nowadays, mostly it was packed in a proper way with the plastic material and lot of plastics. So try to avoid the less plastic and use the recyclable grocery bags or the cotton bags or a jute bags, which will preserve the planet and the planet's health. So with that, my presentation, I would like to conclude that, are we able to reimagine a world where clean air and clean water and safe food are available to everyone? Where economies are focused on health and well-being, because currently the corporate world is going towards the getting more growing on the economy rather than the focus on health and well-being of people. And the third one is where the cities are livable and people have control over their health and the health of the planet. And most of the Indian cities which you come across with the highly populated cities, they have a huge pollution crisis, both in water as well as the polluted air. So with that, the safe water and safe air and the safe food habits, which can provide the health for all, can be achieved if our planet is safe with the clean air and water and food. With that, I can end my presentation.
Thanks a lot.
Thank you.
Krishna. Sorry, go ahead, please. Yeah, you said I'll end.
Thank you Thank you for providing this opportunity, especially after Rashmi had a lot of innovative works on the community with preserving the plant and preventing pollution and the community greeneries. It's very nice initiative done by the community at Mysore.
Thank you so much, Krishna. So yeah, you're absolutely right. You painted the big picture for us to see where are the problems and where are the possible solutions. And the fact that your presentation and Rashmi's presentation happened one after the other, which was not planned because of the technology issues, it happened this way. It is a blessing because she has shown us in a small community with 20 houses, what can you do to preserve the environment? And you have shown us in the whole world, what is it that is going wrong? And therefore, what do we each have to do wherever we are? So I don't think we could have asked for a better combination between you and Rashmi. We are absolutely grateful to both of you for what you have done today. So thanks a lot and wishing you all the best of health and well-being for giving such a wonderful presentation, Dr. Krishna. Much, much appreciated. So thanks a lot. And I think this leads us very well to the last presentation. And this is from a former drugs controller in Kerala. Unfortunately, because of a meeting that came up and he has to travel to Mumbai, he is not joining us in person. So we are using his recording and his slides. So Lokesh, over to you, please, in projecting that. So while you get that going, so Krishna, you will have to stop sharing the screen, please. Yeah, thank you.
Thank you.
So thanks a lot, Krishna. Much appreciated. So while either Yogi or Lokesh is sharing the screen, this is just to give you a bit of a background. Mr. Ravi Menon is the former drugs controller from Kerala, and he initiated this project called Proud. And one way or the other, we all buy medicines and we dispose medicines in any crazy way that we think of. So this is a very important project which gives us ideas to say, what do we need to be doing henceforth? And for those of us who are more focused on medicines, it is also about how do we take this idea and kind of scale it up wherever we each are. So over to you, Lokesh. Thank you.
Good morning, one and all. First of all, I congratulate the organizers for this webinar since the subject, our planet, our health has very importance in these days. Secondly, I express my sincere thanks to Dr. Sunitha ma'am for giving me this opportunity. Before I start my small presentation, I like to share the pharma background of our country during the pre-independence period. During the Second World War, the consumption of allopathic drugs increased throughout the world and the availability was very less. In our country also, there are very few pharma manufacturing units and we are totally depending on import of drugs. This situation creates India become a dumping ground for the adulterate and spurious medicines. In order to curb this menace, the then government passed an act called the Drugs and Cosmetic Act. Then its rules, that is in 1940 and 45 respectively, the pharmacy students might be knowing the Drug Inquiry Committee report, after which it passes the way in which the enacting the above act. The Drugs and Cosmetic Act, in short, the DNC Act, covers all the major aspects of the pharmaceutical industry like manufacture, quality control of drugs, quality assurance, clinical trials, then good storage practices, GMP, GLP, GDP, sale of drugs, etc. But one area which is not touched by this act or the rules regarding the accountability of unused drugs. As the consumption volume increases, the unused drugs volume is also increasing. This lacuna creates a lot of public health issues like environment pollution, antimicrobial resistance, air pollution, water pollution, etc. due to the indiscriminate use of. To address this issue, a program called PROUD, Program on Removal of Unused Drugs. Program called Unused Drugs started in pilot stage at Trivandrum, Kerala state. So let us start with the presentation. Usually, what are the things ends up in unused drugs? One thing is not to standard quality drugs. Second is banned drugs. Third is expired medicines. Then the unused drugs piled up in household. So, as you know, the not to standard quality drugs are the drugs declared as not to standard quality by the government analysts. Usually, the drugs inspectors takes random samples from the market and send it for analysis. Then, sometime if it is not complying with all the provisions, all the specification as per the official books, the drugs has been declared as not a standard quality, and the same cannot be used for used by the public. Another category of unused drugs are the banned drugs. So usually, after the analysis of the verification of the post-marketing surveillance report, sometimes the benefit ratio and comparing the benefit and risk ratio, the risk ratio is more, then the drug is banned by the government. That is also comes as a unused drugs. The third one is expiry drugs. As you know, the most of the drugs has an expiry date, and after that expiry date, this cannot be used. Another category comes as the free samples that given to the manufacturing companies or marketing companies to doctors for their promotional activities. That also usually comes in large quantities, and that will also create as an unused drug. So the another issue is why this program. So as you know, if it is not properly disposed, so usually the practice is people will dump these water bodies or land or burning in open spaces. These are all creating lot of environmental issues that will affect the public health also. So some of the issues are water pollution, that if it is dumped in the water, the small fishes and other things take these type of things, and again it will come to our food chain. Then air pollution, some of the drugs if you burned openly, that smokes and other will create air pollution. Then if the pharmaceutical waste, if it is not properly having any effluent treatment plant, that is destruction of aqua, flora and fauna. Then there is a chance of recycling also, so relabeling of drugs. Then its main issue is WHO is also more concerned about the antimicrobial resistance. You know that if some microorganisms are developed or some species is developed which cannot be destroyed by the antiviral or antibacterial drugs, that will ultimately lead to antimicrobial resistance. That will be very dangerous situation. This program, when I was Dust Controller of Kerala, launched in April 2019, and the program, the initial phase was we are providing some 100 collecting bins in various places, mainly in medical shops and public places. So these bins have been specially designed, so and having a locking facility. So anybody can, not only the customers or any other person can drop whatever the leftover medicine to the boxes. So these items with a special team we are collecting and keeping in some godowns and segregate it to different categories. Usually this is a human nature. Sometimes people will put other things also. So I have experienced so many ice cream cups and other things also in the these type of bins and so many other things. So we have to regularly watching people what are the things to do. Anyway, so these segregated and this was sent to this incineration plant, which is having all the certification from local body to pollution control department, that they are disposing the drugs with obeying the biomedical waste management principles and other things. The major challenge which I have faced is the thing is very expensive, because no government support and other things, it will be very difficult. So usually collecting small amount from the not public, so like-minded people, it cannot be run in a pan-India basis or in a this thing. And other thing is, as I said earlier, there is no regulatory provision in the Act, who is responsible for the disposal of. Even there are some rules called extended producer responsibility was there, because who is the manufacturer, he has the responsibility for if to take back the goods. But in our country, it is not in place. Then again thing is there is an acceptance, cooperation and trust from the public. So sometimes public will think that again these medicines again they will going to recycle and they will make money, all those things. That's also an important issue to be addressed. There are so many methods for disposal of this waste material. One is encapsulation, other is chemical treatment, landfill, burning in open containers. One of the best thing is burning or incinerating with a high temperature, or chemical decomposition also. Encapsulation is completely making the product in a sealed container using HDPE or something, so inert material, and so there is no seepage or leakage of the material. Another method is chemical treatment. Usually syrup preparations we can treat with some inert, some chemicals, and it can be made it is non-toxic, and you can flush it to the drainage system. The landfill also many cases it is doing, but it is not a advisable things. There is a lot of issues of seepage and other things will come. Then open burning is also not a thing. So best thing is the incineration with a high temperature. So we have to go to because of the incineration plant, and that is also very expensive. So the alternative method is that is the reverse logistics. That is, whenever the product and who is the manufacturer, they have to take back. That is the best thing. But in certain places like in Kerala, it's totally a consumer state. So we are getting 90% or 99% of our drugs and pharmaceutical from other states like Himachal Pradesh or Jammu and Gujarat or area. So whenever as a business perspective, it is not possible to return the things, because once the product is expired, they are losing money. Again, sending back to the manufacturer, then that money also they have to suffer, means they will not do. So what they will do is they will somehow dispose the thing. So that is the major issue. So only thing, the best thing is some regulatory thing, some rules or something has to be framed, and it should be make it mandatory that whatever the leftover medicine, and this has to be taken back by manufacturer. But still, so far it is not there. So from the student sides and other things, they should make a good culture, that adherence to prescription practice, not to store drugs in future use, and whenever the product usage is over, to or periodically destroying the medicine using this type of things, or whenever they are working in a pharmacy or in a hospital, this type of bins are collection centers, and give more education to the public and patients how to use, how to treat these unsolved drugs, and wherever possible, unnecessarily piling of drugs. So usually some business aspects, medicines, the purchasing more medicines for getting some schemes and other things. But ultimately, this cannot be solved out. So these type of things can be avoided. So by scientific planning of purchasing and other things. These are the small things from the side of pharmacy students, and can be done to the public. So I am concluding my small presentation. So I once again thank you, Dr. Sunitha, for giving me this opportunity, and all the best to World Health Day. Thank you.
Thanks a lot. And we have to thank Mr. Ravi for giving us this presentation, and also an excellent idea on what we could be doing in different places, irrespective of whether it's a small community or what we could do from a community to collect all of this and hand it over to where we could, etc. There are several little steps we can take, and we can take a pledge to take today. And I think, that's the start of all good things. Everything starts small, but every drop adds to the mighty ocean. So depending on what Jaye Pillai told us, or what Rashmi told us, what Krishna told us, and now what Mr. Ravi has told us, there are several lessons for all of us. I know we had to start late, and therefore we still, despite having gone up to 90 participants at one point, we are down to 52. So those of you who stayed back to listen, sincere thanks. The vote of thanks is from Chirag. Chirag, over to you, please.
Thank you, ma'am. Yeah, it was a wonderful date in World's Health Day that we are having such presentations, especially that I could relate to from Dr. Krishna's presentation, was that there are people dying with simple things that if we stop it. For example, if you take in case of diarrhea, there are especially kids dying, and since just for the fact, just to point it out, in India, has a child born in India has the less rate of surviving than the child born in Bangladesh or Nepal. That is the conditions that we are facing as a country. So yeah, so small changes could make bigger implications for our health, for the whole planet as well. But yeah, we also have to look in the terms of behavioral change. That Rashmi's presentation was very helpful. When all these sensible things are given to us in such a good platform, we as individuals should be much more inclined and towards what is the actual thing that we are doing. And we should also facilitate behavioral change in other people that we come across. So it is a tremendous learning and tremendous experience of this full platform. We have got it. And thanks all the speakers, presenters here. It was a wonderful presentation, and especially on an auspicious day, it is what we should be prioritizing upon on. So let us start up with starting our individual contribution towards the society, towards Mother Nature itself. Thank you all, guys.
Thank you so much. So we look forward to, Yogi, do you want to talk about the development goals, sustainability?
Yes, ma'am. If I have a little
Please
bit
do,
of 2
please
minutes
do.
time, yeah.
Please do.
So coming to FIP, we have 21st developmental goal, that is sustainability RX. This is a program which covers the 3 key areas, which is to responding to disasters and pandemics, environmental and planetary health, that is climate change, and sustainable services. Also, I have added a resources link about green pharmacy and practices, where pharmacists can develop some strategies and do in their own nations. So please do check that resources. And thank you for attending, and thank you, Sunitha ma'am, for organizing this.
Thanks a lot, Yogi. Without you and so many others, this would never have been possible. So sincere thanks to everyone, and wishing you all a very healthy year ahead. And yeah, it was absolutely an amazing session, Harshini. I agree with you. So thanks everyone, and keep very well. And please stay connected, because we will be doing the health days throughout the year. So as much as possible, we'll try and give prior notice while we try to organize these things. So thanks everyone. Have a good afternoon and keep well. Thank you. Bye.